Good afternoon. Welcome to day 238 at the EMA office where Chairman Kern is back with us. Appreciate it. I know you got your business done. And Sam Bierman from the Health Department, you have some numbers.
I do. We've been on a roller coaster this week. We had a pretty high day, and then yesterday we kind of got back down to a lower level, and today we're right back up there.
But we have some explanation to do today.
We do,
You and the
yes.
chairman will be doing it.
Yes.
Okay.
So as of today, 122,806 St. Clair County residents have been tested, and we are at 9,942 positive test results, which is an increase of 156 from yesterday. And that does include both males and females from under the age of 1 up to their 80s. Today, our daily county positivity rate is 12.6%. And we are at 112,864 negative test results. Unfortunately, we are announcing an additional death today, which does bring our county's total to 229. That was a male in his 70s who had unknown health conditions. And as always, we send our sympathies to his family. For those who have completed the IDPH required 10-day isolation period, we are at 8,794. Before we move on to state totals, we have a bar graph that will be coming up on the screen. We've done these in days past. This is our exposure chart that we have put together from talking to the individuals, our contact tracers that have been talking to the individuals that we've been calling. And as you can see, we have the top four are school, employment, healthcare, employment, other, and visiting a restaurant or bar, and then followed by private gathering. If anyone watched the governor's update today, you might see a graph that looks a little different. Like I said, ours in St. Clair County tracks exposures. That's what this graph shows. The one that the governor spoke about today tracks outbreak locations. So if you notice a difference in those two, that's why. So moving on to state numbers. For state totals, 8,215,129 have been tested. And we have 465,540 positive test results, which is an increase of 10,376. And for deaths, the state is showing 10,079, which is an increase of 49 from yesterday. For hospitalization numbers in St. Clair County, currently we have 67 individuals that are admitted due to COVID-related reasons, and 10 of them are on ventilators. Regionally, we have 122 individuals that are admitted due to COVID-related reasons, and 17 are on ventilators. For our congregate living facilities that are previously or currently have been in outbreak status, these are cumulative cases, and we will only announce any that have had any changes. Freeburg Care Center has 10 cases and no deaths, which is an increase of 1 case. And Marka Nursing Home and Rehab has 8 cases and no deaths, and that's an increase of 2 cases for that facility. We do have some testing available still this week for anyone that is interested. Sunday, November 8th from 8 a.m. to 4 p.m. at McKendree University. And on Tuesday, November 10th, next week, from 10 a.m. to 12 p.m. and 1 p.m. to 3 p.m. at the Dupont Firehouse in Dupont, Illinois. And all of the specific information for anyone that needs it will be on the EMA Facebook page as well as the St. Clair County Health Department page. And I will turn it over to Chairman for his update.
Great, thank you, Sam. We'll jump into the zip code report. These are the COVID positive changes in St. Clair County zip codes today. So in 62201, we went up 7 to 313. 62203 goes down 2 to 297. 62204 goes up 3 today to 183. 62205 goes up 1 to 266. 62206 goes up 2 to 557. 62207 goes up 4 to 298. 62208 up 8 to 583. 62208 up 8 to 583. 62220 up 11 to 725. 62221 up 12 to 903. 62223 up 10 to 616. 62225 up 5 to 48. 62226 up 15 to 1,060. 62232 up 4 to 263. 62239 up 1 to 147. 62240 up 1 to 52. 62243 up 4 to 165. 62254 up 1 to 317. 62257 up 1 to 64. 62258 up 4 to 281. 62260 up 2 today to 202. 62269 up 26 to 809. And 62285 up 5 to 176. As Sam said, our daily county positivity, this is St. Clair County number as calculated by the Health Department, St. Clair County Health Department. Our county positivity today is 12.6%, derived by the fact that they tested. Our 1,238 people were tested, with 156 of them coming out COVID positive. So that's a daily county positivity of 12.6%, which brings our 7-day rolling average now to 9.7%, way above where we need to be to start to get back to some semblance of normalcy. We need to get to 6.5 to do that, so we got a long way to go. Now, the regional positivity to number today, that's what Sam and I are going to talk about a little bit. The state has calculated that today at 10.7%, and that number is calculated the way we always have done that. But Sam, today, St. Clair County has always considered rapid testing as a COVID positive in the testing.
That's correct.
The state has always looked at that differently.
There was a little bit of a differentiation for the way that the state was counting it. If you had taken a rapid test before and you came out as a positive on a rapid, what they suggested you did was get a PCR, which is the nasal swab that gets sent off to the lab and is used with the machines, the lab equipment, and to get that result. So if you did not get that, if you did not go on to get that secondary test, you were considered what the state called a probable, where is exactly what it means, a probable. And they had not previously counted those. So in the big data dump that happened today, the state went back and they took all of those probables and have now dumped them in as positives. Now, it did not affect our regional positivity rate today because it was quite a large data dump. But moving forward now, instead of having to consider those as a probable, any rapid test will be considered a positive and will be tracked as such.
Okay. So with that in mind, the state has pegged Bond County at 17.8% today, Clinton County at 18.9%, Madison County at 40.7%, Monroe County 23.8%, Randolph 11.5%, St. Clair is 18.1%, and Washington County at 26.6%. But keep in mind, that includes the dumping of those numbers for the probables in with how we normally report. The good news is St. Clair County's numbers have always included this, so now the state is getting consistent with how we're reporting the numbers. So when we talk about our numbers being the most accurate every day, everybody's kind of coming to do what Sam does every day.
And that's what we want to do. We want to make sure that stays that way. You know, the 10.7, all the numbers in there. The bottom line, Chairman, is you hit the nail on the head. We've got to get down to that 6.57. And we talked about it a little bit yesterday. With these numbers going up, it's like everything else. The higher it goes up, the quicker it goes up, the slower it's going to take to get it back down. So that's why we keep saying, Team St. Clair, you're doing a good job. We just need to spread the word more that we've got to get people out there to help stop the spread of this virus. I mean, the graph shows it today. I'm glad Sam explained the difference between what we're doing here in the region and the county as opposed to what IDPH was showing today on their news, because it's going to be confusing. I can see people saying, well, I heard the governor say this today, or the IDPH. Why is your graph showing something different, so I was glad you were able to clarify that. The same way with the other county and the dumps that was done. We want everybody to know that we're bringing you these numbers from the health department, and we're giving you the most accurate information that we can, and that's why we appreciate the health department being here every day to answer those type of questions for us. It's a, the other thing we got to talk about, 72 cases under the age of 40 years of age. And we talk about that. We're seeing a trend that age it's everywhere. And but 72 new cases today out of those tests. One new death again. It's terrible, as we always say. One death is too many, but statewide deaths 10,079. Here in St. Clair County alone, 229 deaths, and it's sad. It's terrible. Our heart goes out to everybody that's lost a loved one, and to everybody who's had one that's affected. Especially this time of the year with the holidays coming on. And the other thing, Chairman, is we're approaching the holidays. We know people are going to want to get together, families, friends, and if they don't take the precautions, that number is going to continue to rise. And, we heard the IDPH and the governor say today that the last thing they want to do is more mitigations. But if these numbers continue to rise, public health has to, public safety has to come first.
Now's the time to start planning for your holidays, the Thanksgiving holidays. You're going to see people perhaps that aren't in your normal everyday bubble, that don't live in your house. And at that point, wearing a mask is a smart thing. It doesn't mean that you don't love these people. It doesn't mean that they aren't family, but it just means that you don't get together that often, and you don't quite know the bubble that they're in. And so just a little precaution is going to help to keep this spread. We're hearing, there's word out there that a number of schools may be reacting to the holiday and going to maybe change their schedule after the holidays. 21 people in that list today were teens and under. That's all school age. Those are all school age children, and depending on how old the teen, I would say maybe an adult, but they're all going to be affected by these family gatherings. So it's important just to start thinking about that, having the hand sanitizer around, having all of the precautionary things will only make for a gathering that you'll be able to remember in a positive way, not one that will be talked about in the future.
Well, I think we have to look at it as, if those precautions aren't taken, how are you going to feel if something happens and one of your family members get affected and you lose that loved one, and you know that you could have done something simple as what we're trying to tell you, and what, and it's just not here in St. Clair County. Please watch the news. I don't care what your source of news is, but it's everywhere across the country. Every state is having these issues. It's just not here. We are just trying to tell you how to take some precautions, and just think about that as you hear us each and every day for 238 days, and we're going to be here to continue to tell you we can work on this. We have been. We're going to continue to work on it. It takes a team. Team St. Clair, again, you've done an excellent job of supporting the cause. We read those comments that you leave, the good, the bad. We try to answer as many of them that we can, and we know it's working because you're spreading the word. If everybody would just take some of that negative energy and put it into some positive and say, hey, you know what? 238 days they've been telling us that. They're not going to give up. We're not going to go away until this virus gets under control. So please, let's prepare now and let's get this thing under control. We'll be back with Cindy in just a few moments to translate this into our Spanish communities, and we'll be back tomorrow for day 239. Have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs, mask, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs, mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock